Cut off and left to fend for themselves, 2,500 families have been stranded on the border of Sindh and Balochistan since the floods first hit in August, until MSF discovered them.
There were 2 persons coming. They went by car when it was possible, but this road was completely flooded, so they went through the water. And then they had to take a boat as well. And they took, I think, the boat, and they went by horse as well, I think. And they were reaching the place at the canal, and at the canal it's possible because there are 2 big roads. So then they could continue by rickshaw, I think. And when we came the first time, it was already accessible by car, so we didn't have any problem. And for us it was important because we have all the medicaments. We have 1 truck with all the supply, so it's necessary to have a road to have access.
Sylvie Bachmann is a 30-year-old nurse from Switzerland who's been working with MSF for the past 2 years and came to Pakistan as part of the flood response team. The road is narrow, bumpy and precarious. Much of it is washed away with only enough room for 1 car, but this is a 2-way street. It takes us 5 hours to get to Imam Bakhsh Jamali from MSF's base in Sakkar. It's uncomfortable and tiring, but the hard work is yet to begin. Stealing the shade of a tree, the team gets to work immediately. There are 2 doctors, 3 nurses, 2 dispensers and 4 health educators overseen by Sylvie.
Over there we have the triage. There is 1 person responsible to check the patients. All the patients are waiting there. If there is a child with high fever, for example, or we can measure with this thing how it's the nutrition. If it's severe malnutrition, for example, we can see it quickly, then they can come first. Otherwise, all the patients from there, children and adults, they can come to the doctors. We go to this table. The doctors, they take the history, they write down the medication they need, and then from the doctor, if it's necessary, they go to the nurse. The nurse can do dressings or malaria check. And after this, they go to the dispenser. The dispenser has the medication. He is going to give the right medication. It's written on the card, and he is able to give it to the patients. He explains how to take the medication.
Lined along a canal 25 kilometres long, thousands of people are living in shacks made from sticks and blankets. They'd been here for 8 weeks, surviving on what little they'd managed to salvage and a few bags of food they'd managed to catch from the military's initial aid drops. Cuts and wounds are finally being treated months after they first appeared. Children are tested for any serious conditions. Malaria is an increasing concern.
We have mostly skin diseases. We have upper respiratory tract infections, and we have about 6 to 8% malaria cases.
How worried are you about that?
It's quite a big number, actually. It's because the people that are living here in the tent, they don't have any protection of the mosquito. We were distributing mosquito nets, but they're using now, they start to use it, but we are still teaching them how to use the mosquito net in a proper way.
We met Zarina. Her daughter is 3 years old, lethargic and doesn't eat. They've been here for 2 months without any help.
बच्चे हम निकाल करके आके बैठे हैं और कुछ भी नहीं, भाई भी नहीं है यहाँ, अम्मी अब्बू भी नहीं है, वो पता नहीं कब कहाँ चले गए हैं।
सैलाब में?
जी हाँ।
और फिर आप लोग यहाँ पे रहे और पानी की वजह से कोई आ नहीं सका?
नहीं, कोई नहीं आ सका, पता नहीं कहाँ है, कहाँ जिंदा है, फौत हैं।
The local doctor is recommending Zarina's daughter has an immediate blood transfusion, but MSF wants further investigation before making such an important decision.
क्या बताऊँ बाजी, बच्चे खुश नहीं तो मैं खुश नहीं, बच्चे बीमार हैं तो मैं बीमार हूँ।
The people here belong to both the Sindhi and Baloch provinces and speak at least 5 different languages, which can be difficult when trying to understand complicated medical conditions.
I all the time need a translator because I don't speak any Sindhi or Urdu. And as well, sometimes there are misunderstandings, even if they speak English, but it's difficult to communicate properly. And with the patient, sometimes they don't ask exactly. For example, when a baby has diarrhea, the mother says, yes, it's having diarrhea, but we really have to make sure that it's really diarrhea.
Working in conjunction with local medical staff is the backbone of MSF's work. Communications is just one of the reasons.
We want to train them that they know how is MSF working, how we do it in Europe, so they can learn it. And when we leave, MSF is leaving, then they can continue with the same work. We want to give them the knowledge to do it in a proper way.
I learned many things from MSF. First, we are starting work in Sakkar for feeding, and we open their feeding center, and I learned how to feed the baby, and I learned how to educate mothers about feeding and about hygienic condition of the baby.
The team has only a few hours to get the much-needed treatment to the flood victims. They have to pack and get back to base before nightfall because of highway robberies.